Welcome to the Health Talks podcast. Today, we're joined by our co-hosts, Mr. David Jones and Ms. Jessica Brown. Our today's topic is common STIs and how to avoid them.
All right, everyone, get ready, because today we're diving into a topic that's more common than you might think, but often gets swept under the rug.
Yeah, it's STIs.
Right. We got a really comprehensive guide sent in by one of our listeners.
And we're here to break it all down for you.
Exactly.
Yeah.
No awkwardness, no shame.
Just the facts.
So you can feel confident about taking care of your sexual health.
That's what it's all about, giving you the knowledge you need.
Right. To stay healthy.
Make those informed choices.
Yes. And,
Just thinking about how big this whole issue is, the scale of it.
It's pretty huge.
It might surprise you.
Yeah.
The World Health Organization estimates that over 1 million new cases of STIs
Wow.
pop up every single day around the world.
1 million a day.
Every single day.
That's honestly mind-blowing.
It is.
I had no idea.
Yeah.
And the guide makes a really good point about a lot of these infections kind of flying under the radar because there aren't always really obvious symptoms.
The silent spread.
Yes, exactly.
That's why it's so important to be proactive.
Right.
We're not just talking about, avoiding a little discomfort here.
Yeah.
Untreated STIs can really have some serious long-term consequences for your health.
Absolutely.
We're talking fertility issues,
Yeah.
increased risk of certain cancers.
It's scary.
Yeah, it's a big deal.
Yeah, for sure. Not something to mess around with. And the guide actually goes into detail about a bunch of specific STIs. And frankly, some of the details are pretty eye-opening.
Yeah, for sure. Let's start with chlamydia.
Okay.
It's often called the silent spreader.
Right.
You might not even know you have it.
And then what happens?
But left untreated, it can lead to pelvic inflammatory disease in women,
Oh, wow.
or PID.
PID.
And PID can actually impact your ability to have children later on.
Okay, so that is definitely
Yeah.
a wake-up call.
Yeah.
I mean, that really highlights how important early detection is.
Early detection is key.
For sure. So chlamydia, no joke. And then there's gonorrhea. I used to think that was just a funny word.
Right.
But the guide makes it clear that it's definitely no laughing matter.
Absolutely not.
Right.
Chlamydia, gonorrhea can have very mild or even no symptoms early on.
Really?
Yeah.
Wow.
But left untreated, it can also lead to serious reproductive health issues.
Oh, gosh.
And can even make you more vulnerable to contracting HIV.
So we're seeing a theme here. Early detection, super, super important.
Absolutely.
Now, what about HPV?
Yeah.
This one seems a little different.
You're right. HPV is a virus that comes in over 100 varieties.
Wow.
It's a lot.
100.
Over 100. Some types cause genital warts, which are definitely no fun.
Yeah, I can imagine.
But there are also high-risk types that can actually lead to certain cancers.
Wow, cancer. That's serious. But wait, isn't there a vaccine for HPV?
There is.
Okay, good.
That's the good news.
That's a relief.
The HPV vaccine is incredibly effective at protecting against those high-risk types.
Okay.
That can lead to cancer.
Okay, good.
It's usually recommended for adolescents.
Got it.
But it's worth talking to your doctor about even if you're older.
Oh, okay. Good to know. That's fantastic.
Yeah.
A vaccine that could actually prevent cancer? That's amazing.
Yeah.
Talk about the power of prevention.
It is powerful.
Okay. Now let's talk about herpes. I know this one has a lot of stigma around it.
It does.
It's kind of a loaded word, I feel like.
Right. Herpes is caused by the herpes simplex virus. And there are two main types.
Okay.
HSV1, which usually causes oral herpes,
Uh-huh.
and HSV2, more commonly associated with genital herpes. And a lot of people think herpes is just about the sores.
Yeah.
But it can be more than that.
Right.
It can be more complex.
Yeah, I've actually heard that you can even get flu-like symptoms during an initial herpes outbreak.
You can, that's right.
Wow, so you might not even know.
Right. And while herpes is a lifelong condition,
Yeah.
there's no need to panic.
Okay.
Antiviral medications can really help to manage outbreaks,
Okay.
lessen symptoms,
Got it.
and importantly, reduce the risk of transmission to partners.
So you can absolutely have a healthy and fulfilling sex life with herpes.
Yes, you can.
It's just all about knowing the facts and,
You're getting treatment.
yeah, getting proper treatment and taking care of yourself. Okay, now on to syphilis. This one has kind of a historical reputation for being scary.
It does,
I mean,
and for good reason.
Yeah.
Syphilis is a bacterial infection, and in its early stages, it might not even cause noticeable symptoms.
oh, wow.
Or it can cause a small, painless sore.
Okay.
But here's the thing. if syphilis goes untreated, it can progress through different stages.
Yeah.
And eventually cause serious damage to major organs, like the heart
Oh, God.
and the brain.
Okay, so that's really scary. It really is a wolf in sheep's clothing.
Mm-hmm.
It drives home the point that we need to take all STIs seriously.
Mm-hmm.
Now, of course, we can't talk about STIs without mentioning HIV. This one has definitely gotten a lot of attention over the years.
It has, and rightfully so. HIV is a virus that weakens your immune system,
Right.
making you more susceptible to other infections.
Right.
And if left untreated, it can lead to AIDS. But there's also a lot of hope now.
Oh, absolutely. I mean, it's amazing how far we've come with treating HIV.
Right.
Medical science has come a long way.
Yes. With antiretroviral therapy, or ART, people with HIV can live long, healthy lives.
That's amazing.
And ART also dramatically reduces the risk of transmitting HIV to others.
That is a message worth repeating.
Absolutely.
Okay, before we move on to testing and prevention, there's one more STI the guide mentions.
Yes.
Trichomoniasis.
Trichomoniasis, or TRICH for short.
TRICH.
Another super common STI. Like many others, it often doesn't cause noticeable symptoms,
Oh, wow.
especially in men. But here's the catch. Having TRICH can actually make you more susceptible to other STIs,
Oh, gosh.
including HIV. So even if you feel fine,
Yeah.
getting tested is still important.
Okay, so we've covered a lot of ground here, and I'm starting to see why testing is so important.
Yes.
But before we get into that, why don't we take a quick break?
Sounds good.
And when we come back, we'll dive into all the different ways you can protect yourself and your partners.
All right. Let's do it.
Okay, so we just talked about some of the heavy hitters in the STI world,
Yeah.
and now it's time to shift gears a little bit
Yeah.
and talk about how to actually protect ourselves.
Right.
Because knowledge is power.
Absolutely.
And the good news is
Yeah.
there are a lot of tools in our arsenal when it comes to this.
Lots of tools. Lots of strategies.
Yeah, the guide you sent breaks down several different strategies for STI prevention.
Yeah.
And some are more obvious than others.
For sure.
So why don't we start with the most obvious?
Okay.
Condoms.
Condoms.
Those little latex wonders.
Yeah.
They've been around forever, but they're still the gold standard
They are.
for a reason.
For a reason.
Right.
Condoms are a barrier method,
Yeah.
meaning they physically block the exchange of fluids
Right.
during sex
Got it.
and when used correctly.
Yeah.
And consistently,
Consistently.
they can significantly reduce the risk of most STIs.
Okay, so that covers a lot of bases.
Yeah.
But what about
Yeah.
STIs that can be spread through skin-to-skin contact?
Right.
Like herpes or HPV?
Yeah. That's where knowing the facts
Okay.
and talking to your partner comes in.
Right.
Condoms aren't foolproof,
Yeah.
but they still offer a good level of protection.
Right.
And there's another barrier method worth mentioning.
Okay, what's that?
Dental dams.
Dental dams.
Have you heard of those?
I have, but I have to admit, I'm not totally clear on how those work.
Okay, well, think of them like condoms for your mouth.
Okay.
They're thin sheets of latex or polyurethane
Okay.
that you can use during oral sex
Okay.
to reduce the risk of transmitting infections.
So it's like
A barrier.
a barrier. Yeah, okay.
Yeah,
That makes a lot of sense.
yeah,
It's all about having those
Yeah.
tools in your toolkit, right?
that's right.
Now, we talked about vaccines earlier with HPV,
Hmm.
which is amazing, that it can prevent certain cancers.
Powerful stuff.
Are there any other vaccines that can help protect against STIs?
There is one for hepatitis B.
Oh, okay.
Hepatitis B is another virus that can be sexually transmitted.
Okay.
Can cause serious liver damage.
Oh, wow.
So the vaccine is a really important way to protect yourself.
Yeah.
It's usually recommended for everyone,
Okay.
but especially those who might be at higher risk.
Got it. So vaccines, definitely a powerful weapon
Yeah.
in the fight against STIs.
Powerful.
But the guide also mentions something called mutual monogamy
Yes.
as a prevention strategy.
It's a good one.
What exactly does that mean?
It means that both partners agree to only have sex with each other.
Right?
So if both partners have been tested
Yeah.
and are STI free
Right.
and they stay faithful to that agreement,
Yeah.
the risk of transmission goes way down.
Okay, so it's like creating a closed loop, so to speak.
A closed loop. I like that.
But I imagine even in a mutually monogamous relationship,
Yeah.
getting tested beforehand is still really important.
Absolutely. You never know
Right.
what exposures might have happened in the past.
Yeah.
Open and honest communication about sexual health
Yeah.
and testing history
Mm-hmm.
is essential for building trust and ensuring that both partners feel safe.
And protected.
Protected. Exactly.
It all comes back to communication.
It always does.
It's like the magic ingredient
It is.
for healthy relationships.
Yeah.
And speaking of communication,
Yeah.
The guide also brings up the importance of talking to your doctor
Ooh, yes.
about your sexual health.
Your doctor is an incredible resource.
Why is that so crucial?
Well, they can help you understand your individual risk factors,
Okay.
answer any questions you have about STIs,
Yeah.
and recommend the appropriate testing and prevention strategies for you.
So it's like having a personal sexual health coach
That's a good way to put it.
in your corner.
Yeah.
All right, now before we wrap up this section,
Okay.
I want to touch on something that the guide mentions. The role of substance use in relation to STIs.
This is a tricky one.
The alcohol and drugs conversation.
Yeah.
Not always the most comfortable topic,
No.
but it's an important one.
But it's real.
It is real.
Let's talk about it.
Let's talk about it.
What's the connection?
Well, when people are under the influence,
Yeah.
their judgment can be impaired.
Right. We all know that.
We do.
Lower inhibitions.
Lower inhibitions, exactly.
And they might be more likely to engage in risky sexual behavior,
That's right.
like having unprotected sex,
Like having unprotected sex. Yeah.
which can then lead to exposure to STIs.
STI.
So being aware of your limits
Yes.
and making conscious choices is key.
Super important.
And I guess that goes hand in hand with having those open and honest conversations with partners
Yes.
about boundaries
Boundaries.
and expectations
Before
for
things get out of hand.
Out of hand. Absolutely clear. Communication is crucial.
Yeah.
Whether you're talking about testing history,
Mm-hmm.
prevention methods, or the level of risk you're comfortable with.
It's all about respecting yourself and your partner
Right.
and making choices that are aligned with your values.
That's it.
Well said.
All right. So we've covered a lot of ground when it comes to prevention.
Yeah, we have.
But let's be real.
Okay.
Sometimes, despite our best efforts,
Yeah.
things happen.
We do.
So in the next part, we'll dive into what to do
Okay.
if you think you might have been exposed to an STI.
Right.
And we'll talk about the importance of regular testing.
Okay, good deal. Okay, so we talked about how to prevent when it comes to STIs.
Right.
But let's be real for a second.
Gotta be real.
Sometimes life throws us a curveball.
It does.
Maybe you slipped up with protection. Maybe you're just starting a new relationship.
Yeah.
Maybe you're simply due for a sexual health checkup. It does happen.
And that's where testing comes in.
Yes, testing. The guide you sent us talks about different testing methods, blood tests, urine tests, swabs.
Yeah, there are a lot of different options.
It can all seem a little overwhelming, honestly.
I get it.
I'm not going to lie.
It can definitely feel like a lot of information.
Yes.
But testing is the only way to know for sure if you have an STI.
That's true.
Especially because so many don't have obvious symptoms.
Right, that makes sense.
Yeah.
But where do you even start?
Yeah.
Who should get tested and how often?
That's the big question, right?
It is a big question.
Well, the general recommendation from the CDC is that anyone who is sexually active should consider getting tested at least once a year.
Oh, okay. So it's like an annual checkup.
An annual checkup for your sexual health.
For your sexual health.
Like going to the dentist.
Exactly like going to the dentist.
Yeah.
But what about folks who might be at higher risk?
That's a great question.
Right.
People who have new or multiple partners or who've had unprotected sex should definitely consider getting tested more frequently.
More frequently,
Yeah. And there are other factors that can increase risk too.
Okay.
Like sharing needles
Right.
or having a history of STIs.
Got it.
The best thing to do is talk to your doctor.
Yeah.
They can help you figure out a testing schedule that's right for you.
So it's really personalized.
It is.
Okay. So let's say you've decided to get tested.
Okay.
What can you expect?
Yeah.
Is it going to hurt?
Well, I'm not going to lie.
Okay.
Some tests can be a little uncomfortable, like the swabs.
Right.
But they're usually quick before you know it.
And a little discomfort
Yeah.
is a small price to pay for peace of mind.
I think that's a good way to look at it.
Yeah. And the guide mentions that there are even at-home testing kits available now.
There are for certain STIs.
Oh, wow.
You can actually order a kit online, collect a sample in the privacy of your own home,
That's great.
and then mail it to a lab for analysis.
So convenient.
It's a great option for people who might feel embarrassed or intimidated by going to a clinic.
Okay, so it really seems like there are options for everyone,
There are.
which is great.
But let's talk about what happens.
Okay.
If you do test positive
Yeah.
for an STI,
This is the big question, right?
it is a big question.
Here's the elephant in the room.
Yeah.
What happens?
First of all, take a deep breath.
Okay.
It's important to remember STIs are incredibly common.
They are.
And in most cases, they're treatable.
Okay, that's good to know.
Yeah.
But I imagine it can still feel pretty overwhelming.
It absolutely can.
Right.
But remember, you're not alone.
Okay.
Your doctor is there to support you and guide you through the next steps.
Right.
For some STIs, like chlamydia and gonorrhea, a simple course of antibiotics can do the trick. Other STIs, like herpes or HIV, are lifelong conditions.
Right.
But there are effective treatments to manage symptoms and prevent complications.
So no matter what the outcome of the test, there's always a path forward.
There is.
It's all about getting the right information and support.
That's right.
Now, this guide doesn't just cover the present. It also touches on the future of STI prevention and treatment.
Yeah.
And honestly, some of the stuff they're working on sounds like straight out of a sci-fi movie.
It's pretty amazing what scientists are coming up with these days.
No.
One area that's particularly exciting is the development of new vaccines.
Oh, vaccines.
We've already got vaccines for HPV and hepatitis B.
Right.
But researchers are working on vaccines for other STIs,
Nice.
like chlamydia, gonorrhea, and even HIV.
Whoa, vaccines for all of those.
Imagine that.
That would be a game changer.
It would.
Wow, so vaccines are on the horizon.
They are?
But what about treatments for folks who already have STIs?
Yeah. Well, there's a lot of innovation happening there, too. For example, scientists are working on long-acting injectables for HIV prevention.
Wow.
So instead of taking a daily pill, people can get an injection that would protect them from HIV for weeks or even months.
Oh, wow. That's incredible.
It is pretty incredible.
Okay.
And for people living with HIV, there are ongoing efforts to develop a functional cure, which would essentially make the virus undetectable.
Wow.
And eliminate the need for lifelong medication.
That is amazing.
It's amazing to see.
It really is.
How far we've come.
Yeah.
And where we're headed.
It's really exciting.
Yeah.
And it's not just about new drugs and vaccines, right?
Right.
The guide also mentions how technology is playing a role in STI prevention and care.
It is a big role.
Like how so?
Well, there are apps that can help you track your sexual health. Connect with testing services. And even anonymously notify partners about potential exposures.
Wow. That's incredible.
It's all about harnessing the power of technology to make it easier for people to take control of their sexual health.
That's so important.
It is.
Okay, so we've covered a lot of ground in this deep dive.
We have.
We've talked about all the different types of STIs, how to prevent them, the importance of testing, and even what the future holds for all of this.
That's a lot.
What are your final thoughts for our listeners today?
Well, I think the biggest takeaway is that knowledge is power.
Knowledge is power.
The more you know about STIs, the better equipped you are to protect yourself and your partners.
Absolutely.
And remember, STIs are nothing to be ashamed of.
Yeah.
Incredibly common.
They are.
And getting tested,
Yes.
it's a sign of responsibility.
It is.
Not something to be embarrassed about.
Right. Taking care of your health is
a
good thing.
So stay informed.
Yes.
Stay curious.
Stay curious.
And don't be afraid to ask questions.
Beautifully said. I think that's a perfect note to end on.
I think so, too.
Thank you for joining us today.
Yeah, thanks for having me.
On this deep dive into STI awareness and prevention.
It was fun.
It was. Until next time, everybody, stay curious.